I mean, we all go to the doctor and we know what it's like to feel like we're sort of on the conveyor belt getting things done versus when the doctor leans back for a minute and says, "Hey, how's your dog Cookie? Last time you got a new puppy named Cookie. Tell me about Cookie and can you take Cookie for walks? What can you do?" Um, so I like to do that. I was taught to do that, and I love having my team members or people who do that, or if I have the choice. When I have a patient who comes in and said, "Oh my gosh, I had this awesome physical therapist," I'm like, I'm writing the name down, and that's where I want my patients to go is by other people who are energetic, inspired, and curious, and continually want to learn.
Yes, so true. There's thank you for pointing out that, Doc, that always being interesting, not always not being interesting, but being interested. Because we all are interesting already. We got all the titles and degrees behind your names, but if you become interested enough with your patients, oh gosh, those patients will be your fans forever, ladies and gentlemen. So that's what Dr. Holt is talk about. Be interested in your patients, and then you'll learn a lot more. Just like what she was talking about. She was talking about, hey, how's your dog Cookie? Stuff like that. Simple. Go ahead and write it down. You can put that on the EMR, on your electronic medical record. Put it down there. Stuff that the patient is interested in, because that could be actually your functional goals. If the patient wants to walk the dog, patient will walk X amount of feet while not being pulled by their dog. Because they need upper body strength too, right, Doc? So
That's
again,
right.
Dr. Hope, thank you very much.